Hi, everyone. It is so great to see you all. Slowly let you all join. I am also going to start sharing my screen, and I am so excited for our December ALS Learning Series. Let me get us in presenter mode. There we go. Before we get started, I just want to let you all know that you are muted and off camera. The presentation should take about an hour and we'll leave time for questions at the end. You may notice that the chat is disabled. Um, Please, if you have any questions along the way, utilize the Q&A box. So you can type those in and we'll save time at the end to answer any of those questions. And I'll also be dropping resources. So you won't be able to type in the chat, but as resources come up, I will drop those in the chat. So you should be able to see them. In the meantime, everybody, my name is Anne Marie. I am Director of Community Education here at the Les Turner ALS Foundation. We want to give a special thank you. The ALS Learning Series is made possible through generous donors like the Gilbert and Jacqueline Fern Foundation and our industry partners, Mitsubishi Tanaba Pharma America. We know that with an ALS diagnosis, it can be really hard to figure out what questions are to ask or where to turn to, and that's where we come in. You can visit our website at lesturnерals.org and find all of our educational programming. We have our ALS Learning Series, so if there's a topic that you missed or a previous webinar that you want to watch on your own, you can find those on our website. We also have information guides that provide in-depth information about symptoms and care options for people living with ALS. And we also have my ALS decision tool, which is an online interactive tool. It allows people to kind of weigh what matters most to them regarding ALS treatment options like non-invasive ventilation and G-tube placement. So feel free to visit our website for more information. We also want to support our friends at the National ALS Registry. You can join the National ALS Registry by visiting cdc.gov/ALS. This is a great way to allow researchers and doctors to learn more about ALS. It provides updated numbers on the number of people living with ALS in the United States, the number of diagnoses, and it helps researchers and doctors learn more about maybe who gets ALS or why people get ALS. So again, you can visit the website at cdc.gov/ALS. And with that, I am so excited to introduce you to Dr. Astrid Grouls. She is a palliative care physician and clinical researcher at Baylor College of Medicine in Houston, Texas. She obtained her medical degree and completed her internal medicine training at McGovern Medical School in Houston before completing a palliative care fellowship at MD Anderson. She began at Baylor College of Medicine in 2020 and works on the inpatient palliative care service and at the ALS Multidisciplinary Clinic. Her clinical research focuses on improving quality of life for people living with ALS and spans advanced care planning, fatigue, and financial burden. Welcome, Dr. Grouls.
Hi, thank you so much, Anne Marie, for having me here today. I'm so excited to talk with you all. And while I get my slides up, I'm going to just give a disclaimer here. I did not anticipate being here at home today, but I woke up, thanks probably to my two young children, with pink eye. So if you're wondering what is going on here, that's what we've got going on. And we may have two visitors. There's two cats roaming around the house who I think are very excited for a little screen time and to see you all today. But again, thank you so much for having me here. Can everybody see the slides?
Yes, it looks great.
Perfect. We do have some closed captioning there at the bottom. Um, and just explaining what that is. So, a couple things we're going to be covering today. We're going to be defining the financial burden of disease and factors that make up financial burden. We're going to kind of review some of the history of financial burden research in ALS and compare that mostly to the research in the cancer space. And then we're going to be reviewing some of the most recent literature and ongoing research on financial burden in ALS and identify some areas that warrant further exploration. So, disclaimer here, I'm coming at this from a very academic background. There's going to be a lot of papers in here, and I'm going to try to provide you guys kind of the big picture that I want you all to take from each paper. But I do have all of the titles and the authors listed there in case you want to take a deeper dive. So, um, and I know there were some questions submitted in the Q&A beforehand about kind of where we can go for financial support. And I do have a couple of comments added on that here at the end. So I thought first I might comment on how I got interested in this question. I originally started as a primarily inpatient or in-hospital palliative care physician, and I got consults a couple of times for to help with people who are living with ALS, help their symptoms, and kind of walk through things like advanced care planning. And ultimately, the clinic asked me to join them in May of 2023, and this it's really been a big learning opportunity for me. And I noticed as I was seeing people and families navigating ALS that equipment needs, co-pays, caregiver costs just came up over and over again. And then many of us may remember when a certain medication was taken off of the market. And some people had told me just how that even though there were programs to help with the cost, how much money they had spent on this medication that ultimately was found perhaps not to have an impact. So really, when you think, as I think we all know here, ALS is expensive. But does it have to be, and how can we change that? And as I was kind of thinking through this question, I realized this is something called financial toxicity. This is a term that I learned in fellowship. My fellowship was at MD Anderson, it's very cancer focused. And we learned about this concept of financial toxicity or the burden of cost that is associated with having cancer and treating it. And that term was developed in about 2012, seems to be the first time it pops up in, one of the first times it pops up in the literature. Um, and they specifically use the term financial toxicity to kind of conceptualize this concept of discussing cost as one of the side effects, if you will, of medications. Oftentimes, cancer doctors or oncologists think about the toxicity related with chemotherapy or radiation, and that's why this word toxicity got linked in here. It was really something that is familiar to cancer doctors. And over time, a couple of different models have been developed that think about and kind of break down what are the components that contribute to financial toxicity for people living with cancer. So let's take a quick look at both of those, kind of the two that I like to think through. This one was developed by Dr. Carrera and Dr. Zafar, again in the context of cancer. And you can see on the left, we have more of an objective component. This is going to be how much money you're spending, what is happening to your savings. You could see this concept of all of your costs subtracted from your remaining wealth. And that contributes to your ability to keep up with taking medications or go to all of the recommended appointments, for example. Whereas the more subjective component of financial burden is linked to like an underlying anxiety or discomfort that comes from the stress of dealing with this financial situation. Together, these things worsen overall quality of life among people with cancer and even lead to worse outcomes and worse survival rates. The other model that they have really, this was developed by Dr. White and their colleagues. And what I like about this one is it really breaks down a little bit more kind of what goes into that subjective experience of financial toxicity, the underlying changes and patterns of what somebody is doing with their spending, how it's impacting them psychosocially and behaviorally, how people are coping with this. And seeking additional support. So you can see there's a lot of different things that go into this concept overall in the cancer world of financial toxicity. So there have over time been formal ways developed to measure financial toxicity among people with cancer. There's explicit research being done on how financial toxicity changes our outcomes. And then interventions are being built that really address the ramifications or the consequences of this financial toxicity. We know that data drives change, that this data can drive, what's done in the clinic to help with this problem and, what's done at a policy level. So, kind of moving forward, because financial toxicity is really kind of a cancer-centric phrase, most of the time in the community outside of cancer, you're going to hear the overall subjective and objective components of financial toxicity actually referred to as financial burden. So, moving forward, I want you guys to think about this as kind of what changes in regards to your mental or physical well-being because of changes in your health-related finances. Things like out-of-pocket cost and meeting your deductible, even if you have insurance or not. All of these things we're going to wrap up into this concept of financial burden and how you're experiencing that. And there's a lot of ways that we can think about financial burden and how this can be researched. And I really like this slide from Carolyn Sloan. She does a lot of work in the financial burden and chronic disease space. And so she's letting me use this slide today. And really what we can think about is that the steps to really understanding the research and moving this research forward here, understanding the prevalence or how common financial burden is, what is the impact, how is that changing people's participation in research studies, how can we measure financial burden in a very diverse patient population, then use that to develop interventions to reduce financial burden, and then really see a real world impact on policy changes. So there's a lot of steps here. So let's take a look here at kind of where we are so far in this world of ALS. And if we go back in history, at least as far back as I can find, and I would love if somebody could find something earlier, I'm going to take us back to 1975. And this is the earliest mention that I could find of cost related to ALS. This is an article from JAMA back in the 70s. And it's a review article where Dr. Smith and Norris describe kind of how to manage ALS as a disease. Cost is really only mentioned in the terminal care portion. I don't, language and how we talk about medicine and ALS has really changed since the 70s. So the language here is kind of interesting, but what I want you to really pull out is that they say that there's a clear need for development of extended health insurance to cover patients so they can spend their last days in dignity, free of worry about cost. And they're really talking here about how expensive it is once your insurance no longer covers, the care needs that you have, the caregiving needs that you have, and you've run out of private hospital days. I don't know if since the 70s we've fully resolved this problem, but we have made some progress. The next paper I found is actually in the 80s, in 1986. these two authors, they did interviews of two people living with ALS over 12 months, and they kind of describe what these people were experiencing at the time. And they also provide a pretty extensive introduction on kind of what is ALS and what are the typical things that people with ALS and their families have to work around and deal with in our medical system. And there are multiple mentions, pretty realistic mentions of the cost of care in this paper as well. You can see that there's a mention that at-home care can run as high as $200,000 a year. I don't even know. That was in the 80s. I don't even want to know what that number is now. There's mention here where the first participant had decided not to pursue a folk therapy because the cost was $5,000 at the time, and that's not something that they had. There's a mention of the, kind of navigating caregiving, especially if both the patient and spouse are not retired, if the spouse is providing caregiving, of course. And then there's a mention even of the equipment costs, that some equipment was just too expensive, really, for people to take advantage of. So I'm heartened to see that we were talking about these things in the 80s, but um, I worry that some of the things that are mentioned here are still some things that we're grappling with today. Um, in the 90s, we have some papers that literally focus on the cost of equipment. There's this paper, for example, from Issues in Neurologic Practice. It's from 1993, and they looked at how expensive it is, what's the annual cost of home ventilation. And at the time, it was $150,000 a year. If you convert this in a calculator to 2025 US dollars, that's $340,000 a year. They published another paper in 1996 that showed that these costs can actually be even higher if you are living in a facility, because we have to add on those costs on top. Um, this paper from 1996 also specifically mentions the cost of equipment that people with ALS often purchase. By coincidence, they used a supply company from Houston, where I am. And I was pleased to see that now we were starting to see more recommendations of what solutions might be to this problem. Um, the solutions they propose actually might seem very familiar once we get to the end of this talk. They talked about engaging specialists that are familiar with how to reduce cost, for example, by reducing complications, getting a very timely diagnosis or an early diagnosis. So, for example, so that you don't end up getting surgeries, medications, or treatments that don't actually address what the problem is. Getting patients access to community resources that address costs, and of course, integrating cost of care into our medical decision making and incorporating that into conversations with people and families living with ALS. Again, this was 30 years ago. The case reports and the cost focus papers really continued into the 2000s. There was discussion of the high out-of-pocket costs. In the 2010s, we started seeing more papers on the economic impacts of ALS on a national scale. So, for example, papers that are saying this is how much money ALS is costing all of the Netherlands or Spain or Germany. And we have one of those papers, of course, in the United States as well. This is from 2013. But what I like that they did here was, once again, they attempted to estimate what people with ALS are actually facing in terms of cost on a regular basis. So they took commercial and Medicare claims data for ALS, Duchenne muscular dystrophy, and myotonic dystrophy, and they looked at the cost charged to insurance, and also they had people complete cost of illness surveys to estimate not only their medical costs, but also their non-medical costs and what income had been lost by the family. So when we look at the annual medical costs, you can see that the estimated annual cost of ALS was over $30,000 a year for commercial plans and over $31,000 for Medicare plans. And that's higher than the two other neuromuscular diseases that they looked at. And then when they looked at these these illness these cost of illness surveys or diaries that people collected. Again, people with ALS are facing higher costs for things like moving or modifying their home, paying for caregiving, paying for travel and food than people with Duchenne muscular dystrophy or myotonic dystrophy. When you add these up, the $30,000 plus the $17,000, that's $47,000 a year that people are paying or expenses that are coming up. And then this case study, it's just a case study, but it gets cited a lot. So I wanted to mention this one as well. Overman and Lyon, they had a patient who collected basically in all of their expenses over their 10-year journey with ALS from 2000 to 2010. This was a relatively young patient who chose to pursue both a feeding tube and home ventilation, but did not take Riluzole, which would have actually increased the cost further. And you can see that the cost over that decade period from insurance alone was $1.2 million. There was $126,000 in out-of-pocket costs, and they even captured estimates of what charity provided, which totaled almost $100,000 for the year. So their total cost by category and payer was $1.4 million in costs related to ALS. Now, not all of this was necessarily paid for by the patient and their family. You can see that a lot of this was covered by their insurance, but there were substantial periods of out-of-pocket cost and reliance on charity. And you can also see that the costs related to ALS really increased quite a bit over a span of 7 years before tapering off. This pattern has actually been seen in other studies. This is one from 2018, and they looked at Medicare, kind of what Medicare was paying out for people for cost of care related to people with ALS. And you can see that costs, even before diagnosis, this big spike here is the month of diagnosis, this monthly allowed cost, and that monthly allowed cost increased over time even before diagnosis and remained very high afterwards. And there were caps in this case because of Medicare. Policy, luckily, despite, I guess, some of my comments of how things may or may not have changed, policy has responded to some of this research, which I think is important to point out. In 2001, the 24-month waiting period for Medicare coverage was waived for people with ALS, allowing immediate access to Medicare coverage. In 2008, as I'm sure many of you know, ALS did become a service-connected condition, which allows all veterans with at least 90 days of consecutive service to access full VA benefits for their ALS care needs. And in 2020, there was another waiver added so that people with ALS no longer had to wait 5 months in an entitlement waiting period before they could receive their disability insurance benefits. And these things have probably moved the needle. But we just don't know how much because there really hasn't been a way to measure and track that over time. So what is the latest research showing about the scope of the problem of financial burden in ALS? Is there a population that is particularly at risk? And how serious is this problem nationwide? Is this something that every single person faces, or are there subgroups, if you will? So I'm going to share a little bit of work that's not published, but that I'm working on right now. I've really had the pleasure of interviewing people with ALS and their families, their primary caregivers as well. The exact number of interviews, I've done almost 30 interviews, and this includes some written responses from people that preferred to provide written responses. All of them attend an ALS multidisciplinary clinic, and most identified their spouse as primary caregiver. And across the board, I don't think this is surprising to anyone here. Participants reported that equipment and hired caregivers were major financial stressors. And they also reported that there was a fair bit of employment and income disruption, difficulties kind of navigating insurance, difficulty navigating government or nonprofit resources. And there was a fair bit of anxiety as people figure out kind of how to navigate this uncertain timeline. A lot of people were making an assumption that they would progress relatively quickly, but also know that there's some people who do not progress quickly and struggling with how to manage their finances in the face of such an uncertain prognosis. Of course, people also mentioned that they were struggling, saving their money for medical needs while also wanting to maintain or achieve some critical quality of life goals, whether that's travel to family, travel to achieve another life goal, sailing. Um, these were all questions that people are trying to address and balance, and they weren't always bringing them up with the clinical team. So this work is still ongoing. But that's just kind of a sneak peek. We've also looked into GoFundMe campaigns. Um, Myself and some colleagues over at Duke University scraped almost 90,000 active crowdfunding campaigns posted on GoFundMe between 2010 and 2020. And we found all of the ones, or a good chunk of the ones, I hope, that were written on behalf of people living with ALS. And what we found here is actually relatively similar to the interviews. Stay tuned for the formal publication. But people are really seeking assistance managing the cost of treatment, equipment and home adaptations, the cost of private caregiving, particularly for people attempting to stay home. A lot of people were trying to address quality of life needs, perhaps like take a trip. Um, and then there are a good chunk of people planning for what I'm going to call their legacy or needs of the family after they were going to die, whether that was ensuring that their children would have money to go to college or ensuring that their funeral would be fully paid for. Interestingly, even though most of these campaigns were not written by the person with ALS or by somebody who identified themselves as the primary caregiver, a third of the campaigns that we looked at reported that the person with ALS had lost their job and was no longer working to their full income potential. So and then there was a number of campaigns also mentioned what was happening to the primary caregiver's income, but that was a little bit more variable because sometimes it was mentioned that the primary caregiver was maintaining work despite caregiving needs because they had to maintain insurance. Um, I've also had the pleasure to be involved in a study with Dr. Hyman Patterson and then Drs. Holland, Elieva, and Passanelli um, in a longitudinal study that was launched in fall of 2022. This followed people living with ALS for a year and asked them to provide receipts for everything that was related to their cost. And while I don't have that data to share with you today, one of the things that we did look at, and this is kind of what happened with the withdrawal and loss to follow-up, one of the things that we did look at was a survey on how severe somebody's financial burden was. You may remember earlier I mentioned that there are ways in the cancer world that have been validated in some other medical conditions to measure how severe somebody's sense of financial burden is. And so we were able to give people that survey 6 months apart to see how that changed over time. So this data is still undergoing analysis, so this is also a little bit of a sneak peek. We had about 80 responses, and two-thirds were men. Most identified as white or Caucasian, married, and had a bachelor degree or higher. So this may not be representative of the true ALS population, but it is a start. We used a survey called the Facet Cost, and in this survey, Your score kind of lumps you into categories where you either have no financial burden, mild, moderate, or severe. And most people, according to this survey, again, that has not been validated in ALS yet, that's why we're doing this work, were designated as having no financial burden, while a quarter to a third of individuals at the 6 in the blue and the orange in the 12-month marks reported at least mild financial burden. We asked some additional questions about financial burden, and we found that 26% of people reported having at least some financial problems in the last 6 months. One person even had to move to lower their mortgage or rent. 6% of people had borrowed money in the last 6 months to make expenses, to kind of meet their expenses, and 10% had other people in the family kind of forgo other medical needs to meet their cost needs related to ALS. And despite that rating of mild for so many folks, 27% reported feeling burdened by out-of-pocket costs, and 21% cut spending to be able to afford their out-of-pocket costs for ALS. So while this FACET cost survey was developed in cancer and other chronic illnesses, I think the jury might still be out on if this is the best way to measure financial burden in ALS. So stay tuned. And then there may even be some correlation with this score with quality of life and functional score, but we probably just don't have enough of a sample size right now to confirm that. There may also be correlations, and I'm not going to dive into this data too much because the sample size really is probably too small. There may be correlations with gender, employment, relationship status, and even education level. So if I were to summarize all of this so far, people with ALS spend a lot of money. The estimates of what people are spending on an annual basis are pretty broad. There is also a loss of revenue streams, and this may be unique from other disease models where most of the expenses are in one category or another, such as dementia primarily having caregiving needs and cancer primarily having medication costs. We know that in ALS, the costs begin actually before diagnosis and they continue throughout the whole disease process and may rise. There's a potential that certain subgroups of people are at higher risk, and people find themselves balancing their current medical expenses and their quality of life goals over time in a struggle that sounds incredibly challenging. So now research is moving more into the consequences of financial burden. If we think that ALS is, a unique condition and carries a unique financial burden, what does that mean for the consequences of financial burden in ALS? And I'm going to start with what we know about other diseases and the ramifications of financial burden in other conditions. So again, I'm borrowing this slide here from Carolyn Sloan. And again, she studies primarily financial burden in the chronic disease space. And we know that about half of people in the US find it difficult to afford their medical care. About a quarter find it difficult to afford their prescription medications, and almost a third forego those medications due to the cost. And research has clearly shown that inability to adhere to recommended care impacts people's outcomes. It reduces their quality of life. It worsens functional limitations. We see more hospitalizations, and we even see higher rates of death or shorter survival. So for example, here in this was a single site study at a cancer center, specifically on people with head and neck cancer being treated with radiation therapy. And they found the survival was very different for people with low financial burden, and that's going to be that orange line up top, versus people with high financial burden. You can see that overall survival, or their odds of overall survival at the 5-year mark, was markedly lower for people that had high rates of financial burden. In reviews that have been done that kind of capture all of the evidence of what's going on among people living with cancer, we can see particularly changes in depression, anxiety, and stress level, and signs of changes in overall symptom burden among people with high financial burden. And even outside of the cancer space, financial hardship is even a predictor for your sleep quality, more so than age, sex, race, marital status, or education among people with obstructive sleep apnea and diabetes. Um, this even spans what we call atherosclerotic cardiovascular disease. So we're thinking things like having heart disease or risk for stroke. Um, People with this cardiovascular disease have an excess of over $5,000 in annual costs related to their diagnosis, and their um, average annual out-of-pocket spending alone is over $2,000 a year. And they found that there's higher risks for this among people who are in lower income brackets, don't have insurance, who are not elderly, or who are underinsured. And they built this model that may look very familiar to you guys from earlier on that shows that just like in cancer, people with atherosclerotic cardiovascular disease in the US have changes in their objective financial hardship and their subjective financial hardship. Again, changes in those hard numbers and the more subjective coping behaviors and psychosocial changes, and these influence people's outcomes. So we know that financial burden affects all facets of health across multiple disease states. Why is this happening? It's a great question. I don't think we necessarily have a strong answer to that. There may be some underlying mechanisms related to stress. For example, among older adults, who are really kind of like living paycheck to paycheck, and are waiting for disbursements from the government, we found that, or that they found that there's higher levels of these stress markers, interleukin, and TNF, and C-reactive protein among people with higher levels of financial strain. So coming back to ALS, we all know that ALS is unique, and there is actually already overlap of some of in what we know about some of the consequences of financial burden. Check the time here. This was a result from the ALS Association's ALS Focus survey back in the spring of 2020. And you can see here I've highlighted almost half of respondents that completed the survey stated that understanding medical insurance coverage and dealing with paperwork really impacted their stress levels. I'm actually kind of surprised it was only half. And then in their later 2022 survey, you can see of the 62 participants who were denied a prior authorization, again, half cited that this caused worry or stress. We know that this is causing stress for people. And when I've interviewed people, people confirm that this financial burden that they experience, it shapes their medical decisions. It influences whether they're able to join clinical trials or pursue them. Some people consider this as they navigate decisions about tracheostomy or ventilation. It influences people's interpersonal relationships. And, speaking with caregivers of people living with ALS as well, it influences caregivers on a daily basis. Even after the person living with ALS has died, caregivers kind of live with the ongoing ramifications of that financial situation. Going back to the work that's ongoing with Dr. Hyman Patterson, that facet cost survey that we conducted at the 6 and 12-month marks, again, did show potential changes in quality of life and functional scores that probably require additional research. And then we also know, this was actually just published this year in the Neurology Journal, that people who are living in places with more deprivation, as measured by something called the Area Deprivation Index, actually have worse survival with their ALS diagnosis. So people with low area deprivation index, which means that their community is less deprived, live somewhat longer than people that are in the middle or higher categories. So what can we actually do about this? Obviously, the research is ongoing, and we don't have specific numbers on what percent of people with ALS in the United States are dealing with this problem, but that doesn't mean we shouldn't be pursuing interventions at the same time. So what do we know about that? Um, is it going to be multidisciplinary clinics? Is it financial counseling? Nonprofits already do so much, but is there more that needs to be done? Um, the data is a little bit sparse. This was a paper actually done in Ireland and published in 2017. And they mention here in the conclusions that there was a reduction in healthcare spending when referral pathways to ALS clinics were improved. But again, this is primarily more in that pre-diagnosis phase where the costs tend to be lower already. But what they found was that this is mostly due to reduction in unnecessary testing and reducing interventions such as surgeries to try to fix weakness that is actually ALS. Thinking again about what interventions are helpful, this was an article in 2009 published in the ALS Journal, and they looked at the cost of ALS according to type of care. Fortunately, this is not based out of the United States. This is based in the Netherlands. And the people in this study were asked to fill out a cost diary for 6 months and divided in groups based on where they were receiving their medical care, whether it was in a multidisciplinary clinic or more of a general care location. And generally speaking, they found in this study that there was no change, like no big change in the cost. The monthly costs were 1336 euros for people receiving multidisciplinary care and actually slightly lower for people receiving general care. But again, their medical system is a little different from what we have here. So if we're looking outside of the ALS space, this is a great scoping article of interventions that have been done, again, in the cancer world. And they have a really nice table here that highlights relevant studies. I'm zooming in on it a little bit for people. And the three things that they found that were the most impactful on financial toxicity were actually having cost conversations in the clinic setting, integrating copay or medication assistance, and remembering that most of the financial toxicity in cancer is related to that medication cost. And the third thing they found was that having a multidisciplinary team was helpful. And of course, some of these things are easier and more affordable to do than others. And when I was interviewing people with ALS, people with ALS and their caregivers were telling me that there's pretty inconsistent patterns in bringing up cost in their clinic setting. Some clinics bring it up, and some people felt like it did not come up in their clinic. And many people said that it would be helpful to have more of a central database of resources where everything was more easily laid out of what was out there and what could be helpful. So I'm going to give a little plug here to two medical students that heard about this problem and wanted to do something about it already. So at the Baylor ALS Multidisciplinary Clinic, we have two medical students, Minwin and Nikita Pathapati, who are actually trying to tackle this head on as part of their Albert Schweitzer Fellowship. And they are working to create a local database. This is a screenshot of just part of it, of all of the resources that are available to people who live in Houston and have ALS. It's got everything from 211 on here to some county-specific and city-specific resources. And then they've also converted this into a handout so that if we learn about problems and relating to cost and making ends meet, we can point out specific things that people can pursue and look into. So what can you do right now based on the evidence that we have so far? I would say insist on talking about cost of care in your appointments, especially if you're in a multidisciplinary clinic. Engage with the multidisciplinary team in an open discussion about your cost. You may find, and we will never know this until we do a research study, that being proactive about these things may improve your quality of life, may improve your survival. but the data just isn't there yet. So what is next? This was kind of the model of financial burden and the steps for research that I showed you earlier from Dr. Sloan, who's in the kind of more of the chronic disease space. But when we think about specifically what's next in financial burden research in ALS, this is my personal thoughts on kind of where we are and what is up next. We still don't know how common financial burden is in the ALS community. We don't know if it's something experienced by 10% of people or 90% of people. We don't 100% know how to define high financial burden among people living with ALS, nor do we fully know the scope of consequences for people living with ALS or their family units. And we still need a reliable way to measure financial burden. So once we address these questions and establish kind of the scope of financial burden on a national scale, we'll be able to better understand what components we can intervene on. What is it about financial burden that causes the most consequences? If financial burden in ALS does change our survival, why? And how can we intervene on it? How early can we catch this problem to try to reverse or prevent its effects? And finally, we really need to be building and testing interventions. What intervention helps the most? Will it just improve that financial burden number, or will it actually impact survival or quality of life metrics? Do people living with ALS and their families benefit from the same intervention? And is one intervention even enough? These are all questions we just don't know the answers to yet. So, if I'm going to summarize, as you all know, ALS is a unique disease, and that probably means that financial burden in ALS is unique as well. It has known ramifications on symptoms, quality of life, and survival in other medical conditions, and probably does in ALS as well. Research shows that people living with ALS um, really do have that impact before diagnosis, and it increases afterwards. But we still need research to find ways to effectively measure this and capture all the ramifications. And that's, I think, how we can ultimately move forward with, interventions and policies that are going to help. So that's my spiel today. Um, and I thank you all for listening and for being here. And I'm very open to questions. And yeah.
Thank you so much, Astrid. I really, really appreciate that. Really thoughtful and not only historic, but really thorough review of what we know and kind of ending on some areas that we can actually act on. Um, we do have, I have a question that I thought this part where when you were interviewing folks about, have finances come up in your clinic visits or your doctor's visits. Do you have any advice? I guess it's two parts. Any advice on if I'm somebody living with ALS, how to bring that up if it hasn't been brought up in clinic? And then on the flip side, as a practitioner, maybe some advice on how to ensure that we're covering all of that. Because if we say we're delivering holistic care,
Yeah.
this is part of that holistic care is making sure that people feel financially secure in this.
Mhm. Absolutely. That's a great question. In terms of how to approach the question as a patient, I recommend being just as direct as possible. Some physicians and some medical teams may not bring up cost of care because they're worried about offending people or implying that you may not be able to afford your care, or don't want to make it seem like certain care might not be offered because there's an assumption you can't afford it. But if you're very direct, especially if there's a new medication being added on or a new piece of equipment that you might be talking about, saying, hey, how do most people pay for this? Um, is just a very open-ended question that can really open that line of communication. Some electronic medical record systems have integrated some cost of care tools for physicians. For example, as they're ordering a new medication, it will give them a guide for how much that medication might cost. And if you've mentioned cost, it may prompt a physician to think, hey, I've got two medications. They basically both work the same. My default is to order one, but as I'm looking at your specific insurance plan, the other one is cheaper. So sometimes there's things like that built into EMRs that people may not be considering unless somebody has brought it up. If you're not comfortable speaking to your physician about it, that is okay too. There's a reason we have multidisciplinary teams. Um, at our clinic, we have a social worker, and she's a big part of this conversation as well, and helping people navigate that process. Hi, kitty cat. Finding affordable caregiving and navigating what resources are available in the city. So if it's not something you want to say directly to your physician or your other care provider, you could always just ask to speak with the social worker and have a private conversation with them as well. As a physician, and especially in ALS, there's a lot to juggle in a visit. And even though I study cost of care in ALS, it's not something I always remember to bring up too. So I am guilty of this as well. Um, but open-ended questions on the physician or the medical team side can be really helpful just as a screening tool. Hey, what questions do you have, or about, do you have any questions about resources in the community? Would it be helpful to talk to someone about, um, how people afford this equipment, or have you had any trouble picking up your medications? Might be just an open-ended question where people have the option to bring up the cost when they pick up the medication. And taking a look at your electronic medical record and seeing what is already built in there that might be helpful to you.
Yeah, that totally agree. Totally agree. And I really like the idea of um posing that question of like, gosh, how do other people um cover the cost of XYZ? I think that is a really nice, easy like sequitur into that conversation.
Mhm.
Another question that had popped up was, what advocacy or policy efforts could we recommend organizations focus on to help reduce that financial burden?
Yeah. Um, I am not the most up to snuff on all of the amazing policy efforts that are out there myself. I have heard of some that specifically focus on helping with caregiver costs and
Mhm.
helping to ensure that people who are providing, like family caregivers, are getting reimbursed for their time. I think that is
Yep.
a good start because that caregiving cost is probably the one that I've heard come up the most. Um, I don't, I worry that that's not the whole solution
Yep. Hmm.
for a variety of reasons, both because there's so many other costs that come with ALS that are expensive, but I also think it doesn't address for that caregiver some of the things that they lose in terms of like formal job experience, getting back into the job market afterwards if they want to is can be very challenging. And then also thinking about if they are paying into Social Security and things like that, that's not possible if you're providing full-time caregiving. I think getting reimbursed for your caregiving is a great start, but probably not a full solution. Baby steps are important though.
And I think the ALS Better Care Act, I've
Yes,
heard,
of
is
course.
supposed to be reintroduced. That bill proposes no cost sharing for patients and for multidisciplinary care for Medicare beneficiaries. So I think that's always something
Oh yeah.
that we can easily rally behind.
Mhm.
Um, and totally agree. I think the Elizabeth Joel Foundation might also be proposing some caregiver, um, a bill that would help create some cost associated with caregiving. Um, I know you can also look at the ALS organization or ALS Association, my goodness, at als.org. They
Mhm.
have a way of, they've kind of graded each state on their support for ALS.
I
So
love
you can
that.
always look up your state to see, does your state provide um, funding for ALS through appropriations? And if not, like how can you help support your state in getting that funding? So that could be another really great place to head to. And then one more question that came in. They were really, really impressed with your two medical students creating
Yeah.
that list for Houston. Not necessarily a question, but just a shout out for anybody else on the call. And I would absolutely be happy to champion something similar, but a similar national database
Mhm.
for people to be able to look at what support is available in their area, I think would be an incredible project. I know that your ALS guide, so if you visit youralsguide.org, I believe they have a list of different grants that are available. Some other kind of national organizations, and I'm happy to drop them in the chat right quick, would be
Mhm.
Team Gleason. Um, they can be found at teamgleason.org. They're great for helping cover the cost of copays for um, communication devices. They're helping fund some seat elevations for wheelchairs and even, I think, some portable wheelchairs. We also have ALS.org. This is the ALS Association's website. Live Like Lou
Mhm.
org is another really great resource for folks. They provide scholarships for folks, but I believe they also have small grants for home modifications. You can visit iamals.org to learn more about advocacy and advocating for ALS, and then ALS United
Mhm.
because if your multidisciplinary clinic isn't affiliated with um, the ALS Association, they may be connected to alsunited.org. Um, and those are kind of off the top of my head. Um, Yes. Oh, and
Yeah.
the PVA, Paralyzed
Yeah.
Veterans Association.org. That's another really great nonprofit that can help
Mhm.
veterans, as you mentioned, get connected to the benefits that they
Mhm.
um, deserve and are offered to
Yeah.
them.
And of course, as Lauren pointed out, don't forget
Yeah.
that you guys at the Les Turner
Oh, sure, sure, sure.
Foundation.
Yes. We have educational resources, support groups. Those are all free of cost. And if you are affiliated with us, we also have some need-based grants that we can help people with.
Mhm.
So yeah,
Yeah, I think it would be really wonderful to turn Min and Nikita's efforts into something nationwide. And I think what's really unique about what they've done is such a thorough dive into local and state, like city, county, and state level resources. Those are going to be variable in every single state, but creating a map that people could click on or something and get that list, everything from like food related costs to, keeping your power on. And then of course, the expenses of ALS itself. Yeah.
Astrid, thank you so much for your time today. I
Thank you
so
for having me.
appreciate it. And double thank you for coming on, just not feeling 100%. So I really,
Oh,
really
thank you guys for
appreciate that.
tolerating these pink eye.
Yeah.
Awesome.
Oh, goodness gracious. Um, just an absolute wonderful presentation on a topic that we just need more highlight of. Everyone who is still on the call, just want to thank you for your participation today. Stay tuned for us in January. At the end of January, we will have Kara Bischoff, who's a doctor at University of California, San Francisco, a partner of Astrid's. She's going to be talking about the benefits of palliative care for people living with ALS, so that'll be a can't miss. Um, and yes, somebody had a question about this being recorded. It should be up on our website within the next couple days. So YouTube channel, and you can also find us at lesturnerals.org. All right, everyone, in the meantime, have a great rest of the year. It seems wild that I'm saying that. And I hope everybody has a safe and wonderful holiday season. See you all in 2026. Thank you.
Bye.
Bye.